connecting people out.
Great. Tom?
Excuse me, retired employment professional. So my 3 words would probably be career coach, entrepreneurial, and passionate.
And somebody new? Did you see that person? Oh, okay. Hi. Oh, okay. So they. Oh,
Another
sorry.
person just came in.
Yes,
Yep.
I just snuck in. Ellen Lamb, Healthcare Administration, almost. My 3 words would be detail-oriented, financial management, and compassionate.
Okay, thank you. Thank you for coming in. I know it was rough. I don't know if it was rough, but it was a busy holiday for everyone. So we're going to be hearing from Starla Bryant. She's the new owner of the Assisted Living Locators in Virginia. She is drawing from personal experience, drawing upon her personal experience. She opened up her Assisted Living Locators franchise to help provide care and guidance to families when they need it the most. And we could all relate to this topic because we have parents who are getting older, as well as ourselves, and the elder care market is one of the most booming markets right now. So, thank you.
Thank you. Good morning, everyone. As Gail stated, I'm Starla Bryant. I'm the owner of Alexandria Assisted Living Locators. And what we actually do is we're a referral service for families to help families navigate through that process of finding senior services or services, period, for your loved one when it comes to in-home health care, assisted living, independent living, or any of those types of services. And my goal this morning is to help you understand the process and to discuss with you what to look for and the things that you need to be aware of when you're getting ready to go through that process. As Gail stated, you know, we all are aging, we all have parents, we know someone that is aging. And the way that things are going with this industry is that it's going to be overwhelming within the next 4 or 5 years, as they say. They say, the last study I read was one that said that there's 10,000 baby boomers that are turning 60 every day. So that means that we are in for some real heavy, hard times for when it comes to taking care of seniors. And the reason why I'm in this business, excuse me, are for personal reasons, because my mom, I'm from Florida. My mom came up from Florida to spend Christmas with me in 2014. She had a stroke on Christmas Eve. My sister and I were totally lost. We had no clue what we needed to do, who we needed to speak to, or what we needed to even begin to look for. So fast forward, we lost mom in February of last year, and then I lost my job in September of last year. So I had to do some soul searching to figure out there's something that I need to do, because I don't want another family to go through or endure what we went through. So I was given the opportunity to buy into this franchise, and I knew that this was my calling, because my goal is to make sure families understand what it is that they're getting into and understand what it is they need to be concerned with and get things in place before they actually need it, before the crisis hits. So these are my objectives today: to define caregiving, discuss the different types of care and the living options, possibly how you can pay for it, the details of care levels, and also how to start that conversation, because we know that this is a difficult conversation to start with anyone. When you're talking about losing some of your independence, that's a hard thing to grasp. When you talk about someone that is having some memory issues, that's hard to grasp, because that particular person does not want to, or does not really realize that they're changing. Someone that has dementia or Alzheimer's, they know something is going on, but they don't know how to articulate what it is that is going on, and they get extremely frustrated. So my goal is to help families, try to work through that and take away that stress. There are a lot of folks that want to stay home, which we don't blame them. Everybody would like to stay home. So there are different options out there if you want to stay home, depending on what it is that you need, what the need is. If you have someone that has all of their faculties about them, but every now and then they may have a fall or they may forget something. You may just want to have someone to come in and be a what they call companion care. Someone that will just be there to talk to that person, just to take that person on errands. If they need a meal fixed or anything like that, they'll be able to do that for them. Because everyone does not want to leave home. A lot of folks, you know, they've been in their homes for 50 plus years, and if they can stay home, that's where they want to be. So I help the families find those services also. One thing that people don't understand is that there are options that you have when it comes to in-home health care. And in-home health care is a good fit for some, but not for all. It's a little bit less expensive, but then again, it depends on what the need is. Like if there's a need where the individual needs 24/7, round-the-clock care, you may want to think about putting that person into a community where they will have that and the cost will be less. Your independent communities are basically, as they say, independent, where you are there and you still have your independence. You can come and go as you please. You don't have to have someone to come and look in on you, but you have that ability to have that if you need that. You don't have to have someone there with you 24/7, but just in case you want to have someone to come and look in on you, you can do that. You have options also to be able to have some of your meals made. So your independent living, you're not losing your independence because you still can get around and you still can do what you would like to do, but you just want to downsize, or you want to go into a place where you can have someone there just in case you need it. And that's the independent care is the most versatile of all of the types of living situations for seniors and families. And as I said, the cost can vary when it comes to the independent care communities, but it just depends on the level of care that is needed or anything that may be extra. Okay, your assisted living facilities, they are basically like apartments, just like independent care, but the difference is you actually have folks there that are there to take care of you if you need that extra help. Say for instance, if you need to have someone, if you have someone that's a fall risk and you need to have someone to be with that particular person to make sure that they don't fall, you have that opportunity in assisted living community. Also, you have the ability to have in-home health care to come in. If you want that, you can have someone to come in to sit with that person. But the difference between the assisted living community and your independent community is that you actually have that nursing care, that skilled nursing care that will be there for you. Also, you will have the ability to have physical therapists that will come in and take care of your needs. Also, they have on-call doctors, they have on-call podiatrists and things of those nature. So it just depends on what the need is of where would be the best fit of what you're looking for. You also have that the 24-hour oversight, safety and security. As an example, and I'll talk about this later, when you have someone that have memory issues, if they have Alzheimer's, dementia, or any of those cognitive issues, sometimes those folks are considered flight risk. So therefore, they have them in a secured area so they cannot wander, they cannot get out on their own. So they are basically in a situation where they have to have that 24-hour care, because there have been situations where folks have actually wandered off and gotten lost and they don't know where they are for a very long time. And the cost of the assisted living communities, they also vary. It depends on what your need is, once again. It depends on also the levels of care. Your assisted living communities, they are actually licensed by the state and they get audited regularly. So there is a website through the state that will give you all of the ratings. It's the state of Virginia regulatory healthcare, something, I can't remember the exact title, but if you Google regulations, Virginia regulations, healthcare, it'll pop up in the list. But what they actually do is they come in and they look at the different communities and they look whether or not they have any violations. They will actually state those violations on the website so you can see if there's been any violations and have they been rectified. Because when you are looking for a place, you want to make sure that, number one, when you walk into that facility, you want to make sure that it smells clean. If it does not, that's red flag number one. Because you do not want your family member in a situation where they're not getting the proper care that they need. When your family member needs assistance, you want to make sure that there's only 2 to 3 minutes time lapse when they are ringing their bell or they need what they need before someone will come and help them. You don't want to be in a situation where you have your family member just there and they're not being taken care of. So your assisted living communities can also be a home, a group home. Some folks are buying homes where they're actually turning them into group homes that have anywhere from 5 to 10 beds. And these are your smaller homes, and these are your communities that are more intimate than your larger communities. So if you have someone that wants to be in a more homey environment, the group home is probably the best place for them, because you also have that more intimate care. You have more one-on-one with the care provider and the residents. Your assisted living homes can both have private and semi-private rooms depending on the size of the home. We are noticing that there are more homes, group homes, that are being opened up in the DMV area. And the reason for that is because we're realizing that a lot of folks don't want to go into your larger communities, because your larger communities, it has its pros and its cons depending on the individual. Your larger communities, there's a lot of stuff going on, a lot of activities. So if your loved one loves to be social and like to have a lot of things going on around them, the community is probably the best fit. Now, if they're less sociable, I should say, and they like to be more to themselves and they don't like all the hustle and bustle, you may want to think of a group home. And the cost, just like the assisted living facilities, for the group homes, it can vary. Once again, the main factor is the level of care that your loved one is going to need. A lot of folks don't realize that when you're looking for these type of services or these type of communities, there's what we call care levels, and I'll get into that more. But those care levels are actually levels that actually can increase what the base rent is going to be. So you want to make sure you're familiar with all of that information so that you don't have sticker shock. Your memory care communities are your communities that deal with folks that have cognitive issues, such as Alzheimer's, dementia. These communities are communities that have staff that are specifically trained to deal with individuals that have these memory issues. What we found is that when you mix up the different demographics as far as memory issues versus non-memory issues, the folks that don't have those memory issues, they start to decline, because they start to, for whatever reason, they start to see the folks that do have the memory issues, and they start to, for whatever reason, start to just kind of mimic them and not be as active as they can be. So the industry has found that it is very important to keep those that are really, really memory impaired, to have them have their own social settings versus the ones that are that don't have it as deep as the others. Because what will happen is that you'll have the mixing, and you'll have the folks that will just kind of go downhill. So they're setting up communities that are strictly for the memory impaired. As a matter of fact, I'm on a board that we are getting ready to set up Reston as the first dementia-friendly community in the state of Virginia. And what we decided was that we were going to follow the model. Denmark has had these type of communities in place for over 10 years, where they've actually trained the business owners, and the folks that deal with the communities, customer service skills, so that they can work with folks and they can actually identify people that have some kind of memory issue. Because a lot of folks think that when someone is getting old and they start to forget things, they want to attribute that to just getting old. Sometimes it's more than that. And you have to be aware that they take a different kind of speaking to, care, and all of those things. So we are going to set up Reston as the first dementia-friendly community in the entire state of Virginia. And depending on how things go, we hope that we can go ahead and set up some more in Virginia. I know in DC, that not in DC, but in Maryland, they already have a community set up. And it's been going very, very well, because they're also showing that more and more people are becoming dementia, getting dementia, I should say, or some kind of cognitive memory issues. Things are happening, and they're happening at an earlier age. So these are the things that we have to be aware of to make sure that everyone gets what the services and the care that they need. With your memory care communities, as I stated earlier, they are the communities that are actually locked, because some folks become what we call wanderers, and they will get out and just wander. They don't know where they're going, but they just know they want to be out. So they actually get out and they just start going all over the place. So they have to make sure that these communities are locked. And it's not for the sake of trying to keep them locked down, but it's for their safety. Because when someone gets out and they get turned around and don't know where they're going, bad things can happen. So we make sure that when we go to a memory care community, we look at these kind of things to see how the doors and the alarm systems are set up, and see how if it's easy for folks to get out. I'll never forget, I went to one community where this lady, she just came up to me, she just started speaking to me, and she asked me if I could help her, get out. And I told her, no ma'am, I can't do that. She said, well, you really don't have to help me, because I already know that if I hit that door, there was a door that had an alarm on it. She said, I know if I hit that door a certain way, the alarm will not go out, but it will go off, but the door will open, and I can get out. So, the people with memory issues, they're smart. They really are. We cannot sell them short. So we just have to make sure that we're giving them the stimulation that they need in order for them not to progress rapidly. Because we know it's going to get worse, but we want to make sure that we meet them where they are, and we don't try to take them someplace where they don't want to be, as far as where their minds are. Now, your memory care facilities are just like your assisted living facilities. Like I stated earlier, the only difference is that these folks have been trained on how to work with people with memory issues and with cognitive issues. There's actually specific training, and they're developing more training for folks to work with people that have Alzheimer's, that have dementia, and any of these other types of situations. Because once again, since the population is aging, these are some of the things that we're running into that we know that we're going to have to get a hold of very, very quickly. And the Alzheimer's Association, they're working on, trying to get more people trained to be able to work with people with cognitive issues. A lot of folks don't realize that when someone has a memory issue, it has nothing to do with getting old, but there's something that's going on in their brain. And what they've also realized is that sometimes it's being triggered by something that happened, whether it happens in their past or whether it happened, to them recently, but something has triggered this to come about. So they're trying to work to figure out how we can better serve those folks with those type of issues. Now, your skilled nursing facilities, which we call SNF, those are your really, really facilities that are there. They're the nursing homes. Let's call it that. That's what they call nursing homes. Those are the ones that have the nurses and the doctors there, almost like a hospital, but a smaller version of hospital. But they're there to help those folks that don't have the mobility or they have issues with what we call ADLs, which are activities of daily living. They have issues with that, and they need that 24-hour care. Your nursing homes are also your ones that are most expensive because they have the registered nurses on staff, they have the occupational therapists, and those folks that are there 24/7. So your nursing homes are the ones that are going to cost you the most, but unfortunately, your nursing homes are not necessarily ones that are going to give you the best care either. It just depends on, the location. There have been some situations where some nursing homes have been fined because they don't have enough caregivers on staff, or they don't have enough nurses on staff for the needs of the residents. So you have to be careful when you're looking that you have a good ratio. Usually the ratio for caregivers to residents is usually one caregiver to 4, no more than 6 residents. Because you look at it from the standpoint that if you have one caregiver and you have more than 6 residents that need that caregiver, somebody's going to have to wait. And you don't want your loved one to be the one that ends up waiting for whatever reason. If they fall or whatever the case may be, you want to make sure that they're getting the care that they need in an appropriate time. Okay, the good part, how you pay for this. Okay, well, we know that care is expensive and it's not going to get any better. So there are various ways that you can pay for the care. Of course, private pay, long-term insurance. Long-term insurance is one of those things that a lot of people don't know it exists. But when you do know it exists and you need it, it's very welcome. A lot of people don't know that you can, depending on your age, you still can sign up for long-term care insurance. We were fortunate that my mom did sign up for long-term care insurance, and we were able to take care of her, all of her needs, and there was just a little bit we had to put in. But because she did have that forethought to do that, it did help my sister and I in the long run. Also, if you're a veteran, there are a lot of veterans benefits out there that will help pay for your care. Spouses of veterans, they have some benefits that are available to them. So if there's a need for that, they have that. Medicaid will pay for long-term care in a skilled nursing facility, but it will not pay for care in assisted living facility. And the same with Medicare. It will pay for the medical portion, but it will not pay for your assisted living care. Also, you have what they call bridge loans. If you have any assets or if you have property, you can take out a bridge loan or reverse mortgage. But there are various ways out there that can you can put in place to take care of your care. I also have referral partners that I work with that when a family has a need, say for instance they're not sure if mom or dad has anything or what their assets are, I actually work with financial planners that will be able to come in and help families determine what it is that the mom and dad has or what the need is. So I have referral partners that will work with families when it comes to those important papers. I cannot stress enough to make sure that you have those important papers such as your wills, your powers of attorneys, your living wills, all of those things. Have those in place before you need them. Because if you don't have those papers in place when it comes time, for whatever reason, it's going to be more difficult to get your loved one taken care of or get yourselves taken care of. Because just because it's your spouse or it's your children, that does not necessarily make things easier, because the banks and the other places will not give them your information unless there's something in writing where you've turned over power of attorney to them for them to get that information. As a prime example, it took my sister and I probably 6 months to get my mom's Google account turned off after she passed. 6 months. And we did have all of those papers in place. We sent them everything that they needed, but it just took them 6 months. So I can imagine how much time it would have taken if we didn't have those important papers in place. So please make sure you have those papers in place, so when the time comes, you're not stressing about what you're going to do or what your family's going to do. Levels of care. Levels of care are those various levels that come into play after someone has been, I would say, determined that they can no longer live by themselves. What happens is that an assessment is done, and depending on the assessment will determine the level of care that your loved one may need. As an example, level 1 would be someone that is mobile, don't take that many medications, they don't need a lot of hand holding or anything like that. Level 2 is where someone needs a little bit more help with their activities of daily living, whether it's bathing, whether it's getting up and down, whether it's medication. Now your level 3 is ongoing, where they're not mobile, they need all of their ADLs taken care of and different things like that. So it just depends on what the level of care is, of how much your cost is going to be, of how much your cost is going to go up, versus whether or not you have someone that does not need that extra care. So when you go to a community, make sure you ask them about the levels of care, because that price that you see, that first base price that you see, could not be what you're going to end up eventually paying, because of that level of care that's going to tick it up. So you want to be aware of that. Okay. And this is just a little bit of information about my company. We're here, first of all, our services are free to the families, okay? So our goal is to make sure that families get the help that they need. We get our compensation from the communities that we partner with and the home agencies that we work with. So our services are free to the family because we want to make sure that you're getting the proper information that you need to make an informed decision. The last thing you want to do is to get your loved one placed in a community and it doesn't work out, where you have to end up moving them. Because when a person reaches a certain age, and especially if they have any memory issues going on, it's really, really traumatic to them, for them to have to go from one place to the next. They don't like change. Change is hard. I mean, change is hard for us. So you can imagine how it is with someone else that has something going on. So you want to make sure that you make the best decision that you can for your loved one to keep them where they're going to be, so that they can age in place gracefully. We also take away that stress, because as I stated earlier, been there, done that. And that was probably one of the most stressful experiences that I've ever been through. My background is in aviation, and I spent over 25 years in aviation, and I did a lot of traveling. So when my mom had her stroke, it was a situation where I had to take off time to go to, we probably visited about 15 or 20 different communities to determine whether or not this was going to be the place for mom, where we needed to place her. So I definitely know how it is to have that stress and not know who to turn to. So we're here to do that. I'm part of a franchise, and our goal is to have a franchise owner. Right now we have about 75 franchise owners located all over the country. I'm the only one of two in the state of Virginia, but I do have fellow franchise owners in Maryland and the DC area. But I tell you that to say that we work as a team. So if there's someone that is outside of our territory that needs placing, we have someone that we can call to help the families still navigate through that process. Our company was started by a former discharge nurse, and she saw that there was a need over 10 years ago. She started this business because she saw that there was a need when families were getting their loved ones getting discharged. They had no clue what they needed to do, because all you have is that window. You have 24 to 48 hours to make an informed decision. How can you do that when you don't know what it is you're looking for? You cannot make a decision like that when you have no clue what you need to do. So she decided that something needed to be done, so here we are. We're here to help families navigate through that process. And we're here to be the experts, so that you don't have to worry about trying to become an expert. And you can spend that time with your loved one instead of being out there going from place to place to place to place. Gail, when you said 3 words, you wanted us to use 3 words that kind of told about ourselves. My 3 words would be advocate, caring, and my last word would be passionate. because I'm very, very passionate about what I do. I make sure that families, can have as much time with their loved one as possible, because I didn't have that time with my mom. So I'm here to help those families have that time that they need to have with their loved one, and make sure that it's the best time that they can, that they can have.
Any questions? Sorry, is that?
That's it. That's it. Yes, sir.
Starla, that was very good. Thank you. Very informative. Do you know how the regulatory mechanism works for, let's say, for a private small home? What kind of permits you have to go through?
It depends on the number of beds that the individual wants to have. If they have less than 6 beds, they don't have to get the health permit that others would have to get. So it just depends on the location and depends on the number of beds that they want to have in their facility of how it's going to be regulated, because the more beds, the more, the more regulations. But if it's less than, I believe, 6 beds, you can basically set it up almost like a boarding house type of situation. But you do have to make sure, though, that your care managers and the folks that you have working for you, you have to make sure that they do have the proper certifications, your CNAs and different things like that. You do have to make sure that that part that meets the state's regulations, because that doesn't change. Yes, ma'am.
Hi, thank you so much. That was very, very interesting. I did come this morning because you had spoken about, the flyer did say something about opportunities. And I was wondering if you could give us a sense of what opportunities for careers for ourselves or employment for ourselves you see in the field in the future.
Well, definitely there is going to be opportunity, because, as I stated earlier, because of the way that the population is aging. There is going to be, I know that there's going to be more healthcare providers that are going to be needed. As far as some of these agencies, they're going to need more folks that have the ability to take care of others, such as getting your CNA certification. From what I've been told, these agencies are starting to look for folks that have those CNA certifications and some of the healthcare background, because unfortunately with these agencies, some of these agencies I should say, they don't pay well, and so therefore these caregivers, they work for more than one, so the dependability sometimes is not there. So they're looking for individuals that they can depend on, because you just never know when someone's going to have that need. They're looking for individuals that they can depend on, and that's going to be there, and they're willing to, compensate them for their loyalty and for their abilities. So my suggestion would be, I know that there are agencies like, I'll just give you some that I work with, that I partner with, like Griswold Home Health Care is looking, Care with Love, and these are some local agencies that are in this area that are looking. And probably, let's see, one other folks that told me they were looking was First Life Home Health Care. Okay. So if you Google them and you can find out where they're located, you can definitely give them a call and see, how many folks they're looking for. Because no one has really told me specifically. They just say, Starla, if you come across folks, just have them to give us a call. Okay. Yes, ma'am.
What is a CNA and what type?
CNA is your Certified Nursing Assistant. And it's a certification that basically is for those that are, as they say, assisting nurses, that can help the nurses and the other providers do the work, as, say, for instance, if you're in a community and a resident needs to be brought from their room and taken down for their meals in the dining room, that person would go and help that person get dressed and take them down to do that. but they have the oversight. The nurses there is over, over them, but they're just have that certification just to assist the nurse with those type of duties. Yes, ma'am.
What do you know about assisted living administrator opportunities outside of the clinical and CNA role?
Those are the ones that are a little bit harder to get into, to be quite honest with you. Because most of the time when a community is opening up, they usually already have someone in mind, and they don't really advertise. It's more of a word of mouth and, within the industry. So it's really hard to kind of step into that role, or to get find out when there are openings. So I really haven't heard that much about anyone, looking for someone with that assistance. I mean, with those experiences. But what I would suggest to you is to basically just call one of them, one of these communities. Like, for instance, as an example, Walden Woods, they're opening up out in Leesburg, but out in Ashburn, but they would know through the scuttlebutt in the industry, they would know whether or not somebody is looking. So I would definitely say, just call one of the communities and ask if they've heard it. Yes, ma'am.
Yeah, if you were going to look at opportunities such as that, administration, what kind of certification would they be looking for? Because I have heard of people kind of going on, taking their professional backgrounds and then getting certified. And I'm not sure what the certification is, if it's specifically nursing home certification or assisted living certification, because I don't think you can just walk in from, another professional, even if you've had managerial experience.
I've completed a master's in healthcare administration to get that experience.
Yeah.
Right, and then also there is a certification out there called Certified Senior Advisor. They look for that one. If you don't have that healthcare background, but they definitely look for to be an administrator. They are looking for that healthcare background. At least if you don't have your degree in that, at least have some sort of experience with that. Because there have been, don't get me wrong now, there have been some folks that have lucked up and gotten into these positions because of their marketing background or because of their business background or whatever. But once again, if for those folks, it's who you know.
Yeah.
Yes, ma'am.
Also, you could get a licensed nursing home administrator license, and you could be an RN or you could be a social worker, and you can get that. And then also you could have like a business background.
Yeah.
But in DC, you can, if you have the business, you could do an internship and then sit for the licensed nursing home administrator position. But that particular job is very stressful.
Yes, it is.
I'm sure.
Yes,
Yes, it is.
It's so high, it's a highly regulated.
Yes.
It's worse than Homeland Security nursing homes. It's
I
highly
believe it. There's
regulated.
liability, there's regulatory
Plus
risk.
you got the families you got to deal with.
Yeah, definitely. Yes, ma'am.
I'm sorry I came late, so I may
Okay.
have missed. My mother was a social worker in a hospital, and she did discharge planning for like 20 years. So is what you do kind of the same, and what niche, how's your niche like different
Well,
from what social workers
We
do?
are actually basically an extension of those discharge nurses, and the reason why is because we actually have the personal relationships with the communities and the agencies that we work with. So in other words,
My mother did too.
Yeah,
As
so-
a social worker in a
yeah,
hospital.
and some of the social workers do, but unfortunately most of them don't, because they don't have that time. So what they actually do is just give the families a list and say, these are the folks that that will be able to help you as far as going to, the different facilities. But they really don't know what's behind the scenes. They just know of the community, but they actually have not visited to see for themselves, well, this is a good community based on the needs of your loved one, or this is not a good community based on the needs. So we actually personalize the program to the needs of the individual. Also, we set the expectations from the very beginning. So when you go to a community, you already know more or less what it is you're going to expect, what you're going to pay, what services they provide. So you're not going to go someplace where you can't, your loved one can't afford or something along those lines. So we basically make sure that the families have all of that information up front. We go with the families when they go on these tours too. We don't send them by themselves, so that one, they have someone that they're familiar with, and number two, make sure that those families hear what they need to hear and not a sales pitch. They're not being sold, well, yeah, this is a good place for your loved one because we have the latest flat screen TVs and we have this.
Right.
No, it's not what it's all about. What it's all about is that level of care and how your loved one is going to be taken care of. So we're here to be the advocate and to make sure that you get the proper information to make sure you're making that good decision.
But you are paid by the agencies
That we partner with, right.
So there might be some question about.
No, there isn't, because of the simple fact that we don't have any, as they say, alliance to anyone, because of the simple fact that we work with everybody. Okay, so we're not taking more folks to this place versus this place, or telling them more so about this agency than this agency. No, we're looking at it from the standpoint of the family and what it is that they need, and we're making that match.
Yeah, it's like being a real estate agent.
Correct. That is correct. Yeah, that is correct. Because as a matter of fact, our slogan is matchmakers of senior services. So.
But there's not a lot of opportunity in that area, you don't think, or
Opportunity as far as
job opportunities in doing that, what you're doing?
there is, if you want to go ahead and start your own business, there's opportunity, definitely, because as I said, the
franchise.
Well, not only franchise, there's some mom and pops that are out there also.
Yeah.
And the difference between the franchise aspect and the mom and pop aspect is the franchise aspect, like with a franchise, you have your things already in place, and your ramp up time is less than having to start from scratch and do all those things. So the opportunity definitely is there, but you still have to make sure that you have your relationships. The main thing is you want to make sure you have your relationships in place before you open your doors, because people will only work with people that they know and they trust. And so that goes with everything. So you have to, in this industry, people have to know you and know that you're in it for the right reason and not in it for just to make the money.
Any other questions?
Yes, ma'am.
Just because when you were talking about how expensive it can be, the last, I guess, like 13, 14 months when my mother was alive, she lived was combined independent and assisted. Just the base price alone, you look at that and then you add on everything from getting the haircut done, getting extra meals, getting transported, it adds up.
It can add up.
Real fast.
It can, because that base price that you're going to pay is just for the 3 meals, the 2 snacks, housekeeping for one time a week, housekeeping, and activities, if there's any activities that are going on. But the extras, like you say, can add up. Like if you want to go to the beauty salon, if you want anything extra for, when it comes to extra meals.
Yeah, well, she only got the breakfast and dinner. She had lunch was, I think, like $5 a day extra. So when you talk every day, you're looking right there, $150 a month extra.
So it depends. So those are the kind of things that you have to be aware of when you are, making that decision. You got to make sure you know what you're getting. Yes, ma'am.
So what's the base? What would the base be?
It depends. It could be anywhere from $3,500 a month, or it could be more. And the base, that would be if your loved one, say, did not need an extra level of care. If, for instance, they took more than, say, 10 medications, or if they had issues with falling or mobility, or needed assistance with their activities of daily living, that can, make that price go up. So it just depends. Also, I found that the further out you go, the lesser the price, because if you're not in this metropolitan area, you're going to be paying a lot. But if you're going out, the price could be less than that. If you're going out to the Winchester, Berryville, those type of areas, that's in Virginia, that is. Yes, ma'am.
Yeah, I also assume, and you know what they say about assuming. that if your elder is bedridden and is incontinent as a result of not being able to move, that the only option is the skilled nursing facility rather than assisted living. And I asked because my father, who's 88, he actually is in great shape except for the fact he can't walk. Like he just, he's got some dementia, some early dementia, but he just kept getting weaker and weaker, and he was put in a rehab. He had to be hospitalized, put in a rehab center. This was about a year ago. Even after 3 months of physical therapy in the facility, he cannot stand or walk. And now Medicare will not pay for any type of physical therapy sent to the home, even though the doctor has authorized it. And it's extremely frustrating because for an 88-year-old, his heart is fine, his lungs are fine. He doesn't have any of the major organ failures or anything, but he cannot move. And so my parents have had to hire home care that they're paying for out of pocket. It's costing $6,000 a month. This is not even round the clock. And they're going to go through their assets. I mean, but I don't think there are any options for him other than skilled nursing. It's either skilled nursing or have people come in.
And that's unfortunate. That's what you run into when it gets to that level. Yeah. And that's one of the things that we're hoping that we're going to be able to help, with some legislation that's going to kind of change that a little bit. Because I belong to a organization that our goal is to talk to, the lawmakers to, let them look at what's really going on. Because as we say, population is aging and things need to change because there's help that needs, that people need.
And it's costing the Medicaid programs money.
Exactly.
Because the thing is, in my father's case, and I'm sure there are others in here, as they age, the main issue is the mobility.
Exactly.
He does not need a nurse because he takes some meds, but for a man his age, they're relatively minor. I mean, my mom gives it to him. That the home aid people are not allowed to give him the medicine.
Because they're not.
And it's not as if he's getting complicated infusions or dialysis or all of these things. So he really doesn't need that level of intensive care, but he can't move. Yeah. And so it's a real dilemma. You're kind of between a rock and a hard place.
Exactly. Thank you.
Sorry, isn't there regulation where a family member can get paid as a home health care?
In certain places.
Certain places, yeah. Certain places.
Yes. But is there like classes you have to do if you do that?
No.
Oh, okay.
That's good and that's bad.
Yeah, exactly. Yes, ma'am.
How early in the process should families start to think about investigating these options and having a plan in place? And when your loved one is in still fairly decent physical condition, I know for myself and my husband, I've been working very hard this year on putting a lot of things in place. But this process, first of all, trying to find out exactly what it would cost is not possible on the internet, because if you enter your information, next thing you know, someone from a community is going to get in touch with you.
Exactly.
Right, and then of course a lot of these communities require an endowment of $150,000, $200,000 before you even think about going in there.
That's what we call your CRCC, which are your communities that basically you're buying into. Yeah. And you buy into that community, you move in there, and that's where you stay, because they have it set up where you come in as independent, but then as you age and as things go, as you progress, you still stay in that community, but you move to a different area of that community. But that's for those particular type of communities. So the other assisted living communities, it's basically you come in and when you need and you pay like a rent on a monthly basis. So as far as when you should start having that conversation, as soon as possible, because of the fact you want to make sure that you have a plan in place so that you're not stressing and trying to figure out what you're going to do when that time comes, because that's the worst time. And also you want to make sure that everybody's on the same page and that the person that is, that you're thinking about doing this for, that they have you want to have their buy-in also, because the last thing you want to do is kind of force someone into something that they don't want to, go into or be, a part of. So you want to have that conversation soon. Yes, ma'am.
One of the things I noticed is some of the programs you buy in, they return the money back to you once upon your demise.
Correct.
So it's not so bad.
Yeah,
Like,
they
Brian
return, yes,
Percent.
right, they return a certain portion or all of it back
Yeah, they got-
to
one of
your
my,
beneficiary or whoever, you know, but yes, you do get it back.
One of my coworkers, her mother was in Riderwood,
Mhm.
and that's what they did. She
Yeah.
came in healthy,
Mhm.
and then she lived there, which is a good community, and then they returned the monies that they paid in, the 300,000, and there was a monthly fee. But that place is really nice. I looked at that place myself. I won't be able to afford it, but it's a nice place. I had to have my last days there. Yeah, nice place.
Any other questions? Okay. So, this is our last Monday to do your survey, so if you win, you get a $25 gift card. So thank you, Starla. And
Thank you. Thank you.
also, for everyone who's new, please see Tom.
Right?
So